Здравствуйте, это программа «Интервью» на 24 КЗ, и с вами я, Жанна Khussainova. Сегодня мы поговорим с руководителем офиса Европейского центра ВОЗ по первичной медико-санитарной помощи Мелиттой Jakab о развитии и трансформации первичной медико-санитарной помощи. Melitta, welcome. Thank you very much for your agreeing to participate in our interview program, and also welcome to Astana. I know that you deliberately came here from Almaty.
Thank you. Thank you
very much.
Thank you.
First
pleasure
question,
to be here.
Yeah, same to speak to you. My pleasure. The first question for you. So you are the head of the WHO, European Center for Primary Healthcare, right? So
Right.
What is the main goal of the center? Tell us about the work of the center, and also one more question, why is it based in Almaty, not Astana?
So our center works with countries to strengthen primary healthcare. We are part of the WHO European region. So we work with 53 countries. From here to Kazakhstan to the most western part of the WHO European region. We work more intensively with about 20 or so countries every year. We do very interesting work. We are a center of technical expertise, so to say. And let me illustrate through an example. For example, Uzbekistan wanted to do what many countries want to do, is reduce hospitalization for chronic conditions, for hypertension, diabetes. They wanted to strengthen primary healthcare. And we work with them to perfect a model in one of their regions called Sirdarya. We work with them to expand the role of nurses so that there are more nurses, they do more work, they work with the population, do more education. They invested in digital technology so that there is a much more fluid system and good information sharing. And they also began to work with the local authorities so that each community could set priorities, because in some areas, maternal and child health, very important when the population is younger. But in other areas, especially rural areas, there are a lot of older people who are living alone, isolated, and you need a different kind of approach. So we evaluated this model, and then because it had very good results, we're now working with Uzbekistan to roll it out to the rest of the country. So this is just an example, but basically we offer diagnosis of what are the strengths and weaknesses of primary healthcare in the country. We develop options for development. We work with the countries to implement, and we evaluate as well. Why we're in Almaty? Yeah. I almost forgot to answer your question. Well, we are in Almaty because Almaty changed history. In 1978, Almaty, Kazakhstan, hosted a very significant global health conference where ministers of health from 134 countries gathered, and they made a very important commitment that primary healthcare should be granted to everybody, every single person, free of charge. And this commitment became known as the Almaty Declaration, that is like a mayak in Russian, I would say, a signpost in global health. And so this gives us an opportunity to carry forward the legacy of that very important declaration and to build this amazing partnership between WHO and Kazakhstan in global health.
So it's also about history, right? And the role of Almaty in this whole sphere of primary health care. So we've talked about your work as a center and your initiatives across many different countries. Let's explain to our TV viewers and the whole population of Kazakhstan, what is primary health care, simply?
Very simply, it's your first contact with the healthcare system. And healthcare systems are so complicated, but primary healthcare is the entry point, the gateway to this complex system. It aims to keep you healthy, so first of all, so that you don't even begin to get sick. But in case something is wrong, primary healthcare should diagnose early, so we catch conditions in an early phase when we can change them and manage them. Today, most of the health conditions are chronic, not just acute illnesses, right? Hypertension, diabetes, mental health conditions, heart conditions, joint pain, musculoskeletal pain. So these conditions need to be managed, and there are effective interventions for these much more common illnesses that can be done in primary healthcare settings. So it's of course much more convenient for people to go in their community rather than constantly traveling to the hospital. So this is the first point of contact. In Kazakhstan, it's in the form of a polyclinic. the family doctors, the nurses, the rehabilitation specialists, other specialists. In other countries, it looks different, but they all perform these very same functions.
I see. Thank you very much. So talking about Kazakhstan, we started already. We know that Kazakhstan is one of the leaders, global leaders, recognized as a global leader in primary health care. Can you dive deeper into what makes it this leader stand out in this field, and what factors contributed to earning this title?
Yeah, indeed. WHO is very proud and even honored to work with Kazakhstan so closely, because we consider the model developed here over the last 2-3 decades in primary healthcare as a very important and effective model. It is based in very strong family medicine and nursing, but also it's a multidisciplinary model. There are increasingly psychologists and social workers incorporated into primary healthcare teams. And why is that? It is because today's illnesses are not just biomedical processes in our bodies. They're due to the way we live, where we live, how we conduct our life, whether we smoke or not smoke, how is our income level, etc., so on and so forth. So it's very clearly understood that intervening only by providing a diagnostic and prescribing pills when the underlying cause may be poverty or poor housing conditions or poor diet or smoking or lack of exercise, it is really not very effective, and it's not a good use of people's times and taxpayers' money. So this new model that incorporates the social workers that work together on the social conditions, the mental health specialists, is much more effective. And to show this has resulted in very impressive change for Kazakhstan. Maternal and child health mortality has declined very significantly over the past decades, but even more impressively, the premature mortality from chronic conditions like heart attacks, like strokes, went down faster than in most of the countries in the region. And it is due to this model in large part, and of course to good economic development. But you should be very proud of this model, because Kazakhstan is the only one that introduced this multidisciplinary approach with social workers and mental health specialists in primary healthcare among all the former countries of the former Soviet Union.
So I'm very happy that we are one of those, and we are the leaders in this sphere. So we are the one who have this model, as you said. Okay, I understand about people who live in the cities, right? Who live in Astana, in Almaty, in Shymkent cities. But what about those who live in rural areas, those who live in villages? Do they have the same opportunity to have this primary health care? Or how do your center maybe help them in this field?
Yes, so this is a very important question for a large country like Kazakhstan. Many other countries in Europe are struggling with what to do with the rural areas, where there are increasingly older populations living with more health conditions, fewer people to take care of them. And here again, the answer is not to focus on the medical aspect alone, but seeing people in their social condition. Is somebody mobile? Can they go to the facility and seek care, or do they need to be visited at home and taken care of? So in Kazakhstan is moving towards a model where some of the care is provided in rural facilities, but there are also mobile teams roaming around the villages where people may be too frail to go to the clinic and seek care, and visiting older people. These mobile services are very strong for maternal and child health in particular, but they're increasingly getting there for chronic conditions as well. Kazakhstan has an amazing health train, as you know, this train that is visiting very remote villages. And it's so unique in the region that we have made a movie out of this, which is also shown as a model for other countries. But of course, the future is here. And today, in 2025, if I was a Minister of Health, I would not build clinics in rural areas, because it's very difficult to recruit healthcare workers in these rural areas. There is telemedicine. We have to be much faster adopting telemedicine for common conditions. It's already having great adoption for specialized services, but for common conditions and primary healthcare, this has a great potential. And there are countries that are at the frontier of this, and this would be a good model for Kazakhstan. But just to conclude is to say that over the last few years, I have been living in Kazakhstan for 5 years, and I have noticed during these 5 years how there is increasing attention to rural areas, increasing support for strengthening rural medicine, and increasing investment into this issue. So I know that there will be some really great examples coming out of this.
I hope so. Thank you so much. You told about very different and very successful initiatives, including this train that you've mentioned, I remember. So I want to focus right now on comparing Kazakhstan with European leaders, also in primary health care, right? So the question is, how do Kazakhstan's PHC innovations compare to those innovations that are used in leading European health care systems?
Yeah, so absolutely. As I mentioned already several times, Kazakhstan is a leader in this new multidisciplinary model. So much so that we launched a new initiative in our center, which is to create so-called primary healthcare demonstration platforms. And these demonstration platforms showcase really well-functioning primary healthcare. And the first platform we created was in fact in Kazakhstan, in Almaty region, in Issyk town, which is a semi-rural area, so it fits very well to the discussion we had earlier. And we are hosting other countries to showcase how this multidisciplinary model works in this semi-rural area. We launched similar demonstration platforms in rural Sweden. And rural Sweden is the leader in the application of telemedicine in primary healthcare for rural areas. We in fact took a delegation from Kazakhstan there to see and adopt some of the lessons learned from there. And then our third demonstration platform is in Spain, which also has this multidisciplinary model, but they took it to an extra dimension because the primary healthcare facilities have an inventory of social programs in the community where they can refer patients. So for example, who are the companies or NGOs that provide transportation for the disabled or visiting services for elderly isolated people. So this way, the primary healthcare center doesn't have to have all these services in-house, but knowing what services are available, they can refer patients to those social and mental health services that are equally important. So yes, Kazakhstan's innovations are the front runners for us. We have hosted here in Issyk several countries, all the countries from Central Asia, also Armenia has come, seen how this model works in practice. And the first country beyond the European region, China, came and visited Issyk and Almaty last year to have a bilateral exchange on how to strengthen primary healthcare. So I think it's globally now very well noted that Kazakhstan is at the front line of transforming primary healthcare.
Thank you so much. Thank you for your answer also. And also I want to ask you about the coalition that was proposed by our President Kassym-Jomart Tokayev, during the WHO International Conference on Primary Health Care in 2023, if I'm not mistaken, right? President Kassym-Jomart Tokayev proposed launching the PHC coalition of countries. Am I right?
Yeah, absolutely.
What progress have been made until this day?
Yes, no, that's a really bold initiative, which is to launch a global coalition, and we really applaud the President's initiative. Since then, there has been a lot of progress. So this coalition has been formally announced last May at the World Health Assembly, where all health leaders, ministers of health come together. Countries have been expressing their interest to join this coalition and to share experiences and elevate primary healthcare on the political agenda, because there is very strong evidence from science that there is no development without health, and there is no health without development. So if we want economic development, social growth, prosperity in our country's security, health is really foundational in this. So it is very clear for everybody that elevating health and primary health care in the political agendas is a worthy investment. And there is great interest among the countries. There has been an agreement that the secretariat of this coalition will be hosted by WHO. We have established a team with the Ministry of Health and WHO working out the details of this agreement, and most likely this secretariat will be hosted in Almaty together with our office, and this will be a winning combination, strengthening the political clout and commitment to primary healthcare and the technical excellence that our team has delivered. So good progress.
Yeah, thank you so much. And probably the last question, just a few words, because we are very restricted in time, as you know. How do you see the future of WHO and especially WHO European Center for PHC?
Yes, indeed. Thank you very much. That's a very interesting question. And of course, these are very difficult times for WHO. So we are really looking carefully at what we're good at, what are our achievements, where are our weaknesses. But I'm an optimist. I really believe that this situation today is an opportunity for renewal, renewed focus, and rebirth. With the leadership of our regional director, we are now developing our next 5-year program for the whole of the WHO Regional Office for Europe. It's called the European Program of Work #2. And in his vision, primary healthcare will continue to play an important role, but perhaps even a more important role than previously to address some of the really big problems of our time. Health security, climate change, aging populations, chronic conditions. These are very, very big issues, and primary healthcare has a big role to play. So for our center, we want to play our part. We want to continue those things that have worked well, like our demonstration platforms, our country support. But we have some new ideas. For example, to launch a health diplomacy academy for young Kazakh colleagues so that they can represent Kazakhstan's achievements abroad. And in your TV program next year, I would love to have somebody from Kazakhstan talk to you about some of these important achievements. Also, we would like to invest more in data to understand which systems work better and why. And then the third one is to continue to strengthen our country support. So I'm an optimist about the future, and I absolutely believe in this great partnership we have between WHO and Kazakhstan to go to new heights in global health.
Thank you so much. I also believe in a happy future and healthy people, right? And health for everyone, especially probably right now, modern times need us to do some transformations, and probably transformations of NGOs and different, also different companies and etc. Thank you very much for participation. Thank you for having us and having you in our studio and our program. Okay?
Thank you.
На этом наша программа интервью подошла к концу. С нами была Мелитта Jakab. Всего доброго и до встречи в эфире.